Sarah, do you happen to have the title of today's call thing? Because I don't have that right in front of me. Do you happen to have that? Or well, we're hearing from the Boone County Community Services program, and I'll just go into it. Joanne Nelson is the director of the Boone County Community Services Department. She's been with the department for a number of years, since 2014. First as a program manager and now as director. She has a lot of experience working with not-for-profit organizations over 25 years. And she actually likes working with grants. Okay, can we borrow you, Joanne? She's worked with a lot of grant proposals, grant contracts. In her free time, she likes to travel with her husband, Doug, and their family. And she pretends that she has a green thumb. I do too. Kristen is also here with us today. Thank you, Kristen. Kristen Cummins is the Deputy Director of Boone County Community Services. She's worked for the department since 2016. She oversees the request for proposals, does a lot of contract work also, and she does the work, the annual reports for the department. So thank you both for being with us here today. I'm really interested in hearing what you have to say. Thank you.
Question: the Community Services Department of what?
Boone County Community Services Department. It's part of the county government, is it
Boone
not?
County. All right.
Yeah.
Thank you.
And I'll share what we do and stuff. So thank you for inviting me. We're always willing and able to share everything that we do with our department. And first I wanted to see if I could share I have the ability to share my screen.
Yes, you do. You should be able to share your screen, no problem.
Okay. Let's see. All right.
We've got it. We see it.
Got it.
There it is.
Okay. And what I'm going to do is, sorry, we're going to start from the beginning. Sorry, I'm trying to hide this. I'm having trouble here. So
just start the slideshow and it should go away.
Yeah, I'm getting blocked from it. So hold on a second. Sorry, guys. I'm just going to go with it. What I'll do is, first, I want to welcome everybody to our presentation. And like I said, we always appreciate the ability to share what our department does and, let folks know. So if there's any other groups that you're affiliated with and you'd like us to come talk to you about it, we'd be more than happy to do that. So welcome. So like we were introduced, so our department is part of, we're part of the Boone County government. We are one of the departments that are overseen by the 3-County Commission, but we also have, we're also overseen by the Children's Services Fund board members. So we're going to show you our organizational chart. At the top, you can see that who are our bosses? Basically, they're the citizens of Boone County. And then the county commissioners, and then we come down to our department. And you'll see that little dotted line on the left-hand side, and that is our Boone County Children's Services Board. And I'll kind of get into that more in a second. But I wanted to kind of let you know what our department does. We oversee the Children's Services Fund tax, which is, the tax was passed in 2014, and I'll kind of get into that in a minute. But basically, it brings in about $8 million every year. And with that number seems to be increasing every year. When I first started, it was like around $6 million. So every year it has increased. We also oversee the Domestic Violence Fund, which are fees that are collected from the court systems and through marriage certificate. So a small portion goes to the domestic violence fund. And what that money does is, by statute, we have to put out an RFP at the beginning of September. And there's approximately about 27,000. It depends on, court fees and marriage licenses. And then typically what we do is we get one group, and it has to go to a domestic violence shelter that's within our area. And we've been funding True North since I started in 2014. Last year we did have a different domestic violence shelter who's kind of new and startup, but they didn't meet the criteria to actually move forward. So True North continues to receive those funds and utilize it towards women who were experiencing some type of domestic or fund shelters and for domestic violence individuals. Okay, move on to the next slide. So here's a copy. I believe Pam mentioned this earlier. She had gotten a copy of our annual report, and if anybody is interested in receiving it, we have still have some hard copies, but you can also go on our website and actually see the annual reports I'll have Kristen drop the website in there into the chat. But this is essentially what the community services does. We were created to oversee the disbursement of funds from the Children's Services Fund. We were established in 2014. The first employee was hired in January, and I was hired in. The mission of the department is to support the greatest possible level of independence and self-sufficiency of Boone County residents by promoting their physical, their mental, and social well-being to cultivate a safe and healthy community. And every year we put out an annual report that kind of gives you an overlay of everything that we do, not only with the Children's Services Fund, but any other programs or any other grants that we might have received throughout the year that we're also working on. So how did this Children's Services Fund come about? In 2012, taxpayers passed the Children's Services Fund tax. This is a 1/4 cent sales tax that was established by state statute. And currently there's only 10 states that have this. That includes Jackson County, that includes Boone County, and I'm gonna kind of go over St. Louis County, Clay County, St. Charles County, Franklin County, Lafayette County, and Jefferson County. The thing to remember is that you can't charge more than the way the statute's written, you can't charge more than 1/4 cent. So some counties, and you can do it by a sales tax, or you can do it by property tax. St. Louis City actually does a portion of the property tax, but all the other counties do some type of sales tax. I believe there's a couple counties that do an 8-cent sales tax, but I know in 2012, when we decided to, I wasn't working here, I was working at another nonprofit, and it was called Putting Kids First. And we would go door to door. We had to get signatures to get it on the ballot. And the committee that planned this really wanted to go, okay, if we're going to do this, we're going to go all in, we're going to get the 1/4 cent sales tax. And so the voters approved this by 52%. It passed with 52%. So people understand that having local control of where the money goes they understand the importance of that. With that, the money, the way the statute's written is that the money is overseen by a 9-member board. And in Boone County, that 9-member board is appointed by the Boone County Commission, which includes, I see Janet's on here, so she's part of the appointment process. So the statute allows us to really make sure that we're putting the money towards the most vulnerable individuals. if you guys have any questions, please stop me. I kind of tend to ramble through those things, so. I thought it would be important that you see who the current 9-member board is made out of. We've got Lee Spence, who's our chair, Greg Groupie, Connie Leopard, Michelle Kennett, Dr. Wiley Miller, Lynn Barnett, Judge Bob Auger, Rodney Dixon, and Sebastian Martinez Valdivia. And this is just really a nice group of 9-member board who has an array of experience. For example, Lee is head of the secondary counseling at the Columbia Public Schools. Greg is a retired school administrator. Connie is a business owner. So she's also had some experience with mental health issues and some with children. Michelle Kennett, works for the university, and she's also an attorney. Wiley Miller is a retired psychologist. Lynn Barnett is a retired former school administrator. Bob Auger is used to be Judge Bob Auger, or probably still is, but he actually has some experience with the legal system and understands that as well. Our newest addition for board members is Rodney Dixon, who comes to us. He's a young individual who graduated from, I believe it was Hickman, probably about 7 or 8 years ago, but he now works at Equipment Share, and he does a lot of work with it as apprenticeships. And Sebastian Martinez Valdivia, he actually also graduated from Hickman recently in the past 10 years, but he actually is an associate professor at the university where he does journalism, and his focus is on health. And so he does a lot of documentary, and he teaches there about documentaries. So we're really excited. We have a wide array of individuals. We have diversity, and it's real important for us to make sure that our board represents the community that we actually serve. And like I said, the board actually has the rights to decide where the money is being spent, and we'll talk more about this later. So in that statute that allows counties to pass the tax, that also describes what the funding can be used for. And these are the 11 statutorily eligible service areas. We've got up to 30 days of temporary shelter for abused, neglected, runaway, and homeless and emotional disturbed youth. Unmarried parent services, counseling and related services as part of a transitional living program, prevention programs that promote healthy lifestyles among children, youth, and families, professional counseling, and that could be individual, group, or family therapy, mental health screenings and mental health assessments, respite care services, outpatient chemical dependencies and psychiatric treatment, home-based and community-based interventions programs, crisis interventions, inclusive or telephone hotlines, and psychological evaluations. Some things that explicitly has been written in the statute is that we can't fund any type of inpatient treatment services or transportation services, which, as we know, a lot of times that's the barrier to receiving services. So we have to really try to work around how we can make sure that families are able to access these services. To be honest with you, when the pandemic hit, it really allowed us to really forced us to really take a look at how the services were being offered. So you'll see more telehealth being offered, actually having the therapist go to the family's home or meet in some other place to have therapy. So we've really had to think about how we offer services. Something to remember is that this funding can only go towards children, youth, and families. So any adults that are over the age of 20 cannot receive our services unless they're a parent. We can only fund nonprofit and governmental entities. So that's something else that is written in the statute that we have to explicitly fund. And we can only fund Boone County families. This can be a little tricky when you're providing services up in the Centralia region where that school district covers into an existing county. So they have residents from the other county over there that goes to school in Centralia, but it's very tricky on who you can provide services for. We do provide services to the juvenile justice office, but those residents in juvenile office are considered residents of Boone County. So you may come from another county, but if you're in the 13th Circuit, we can provide services for you. So we're going to talk a little bit in a little bit about some of the organizations that we do fund and the types of services that are offered in the community. So when the board was formed, the original 9 members were appointed in 2013, and they started the hard work of putting together a nonprofit board. And that included setting up bylaws, setting up what this would look like. And the commissioners at the time decided that they wanted to form they didn't want it to be an independent board outside of the county. They wanted to create the community services department. And that's why you get the community services department's formation in 2014. I'll be honest with you, most of the Children's Services Fund are independent boards that have the taxes that are given to them by the county. Our county has chosen to have a department within the county realm. We have to follow all county processes. That means if we have to follow HR regulations, we have to follow the auditor, we have to follow any of the treasurers, we follow facility maintenance. We do the same thing as if we are a department. We are a true department of the county that wasn't originally formed by the Children's Services Fund tax. This really brings a lot of benefits to us because then now we don't have to hire outside HR. We don't have to hire outside legal counsel. We don't have to hire outside accounting. It really does save us a lot of money, and that allows us to put more money back into the community and be able to provide services to individuals. So the Children's Services Board, when they started, they had to put together the bylaws, but they also created their own mission statement. And that was to improve the lives of children, youth, and families in Boone County, to strategically invest in the creation and maintenance of integrated systems that delivered effective and quality services for children, youth, and families. So when the 9-member board first started, what they felt like was they really needed to get an assessment of what the community looked like. And so what they did was in 2013, they did they held forums where they invited nonprofits out in the community to come talk to the 9-member board about what's needed, what do they see out there, what changes do they need to have made. And they hired the MU Institute of Public Policy to put together their first community assessment of what the needs were. So in 2014, we put out our first RFP, which was a lot of fun because it was paper RFP. So we've got in probably close to 60 paper copies of RFPs, and they had to provide multiple copies. So it got a little bit tedious, but we started funding programs in 2014. These programs are funded through what we call a purchase of service model, which means that as we don't give out grants, since we're a government entity, what we do is we provide funding for services. So we essentially put the purchase of service model, a organization, a nonprofit or governmental entity provides the service. then every month they tell us how much they submit an invoice to us and we reimburse them. So that purchase of service model was done. In 2019, the board hired, put out an RFP to kind of look at, okay, do a 5-year evaluation of how we were doing, how the community services department was doing with putting out RFPs, and were we meeting the needs that were outlined in the original needs assessment that was held in 2014. So based on that information that we gathered, we had another report released in 2019, and it looked at whether we were meeting those guidelines or not. We are currently in the process of we have another consultant RFP out there that's going to look at our 10-year span. We'll be celebrating 10 years of giving money to the community in 2014. So we're very excited about having another study done. They're going to look at that 10-year process. And when they do these evaluations, they meet with the organizations that are funded. They meet with organizations that aren't funded. They meet with key community stakeholders. And then they do interviews with staff. They interviews with other individuals out in the community, and then they provide an assessment based on what the services that we've had funded, the services we haven't funded, and look back to see if we've met the goals that we've outlined in 2014 and 2019. So our goal is to have a 10-year anniversary reports released sometime in 2024. It's important for us to make sure that we're meeting the needs of the people and we're meeting them where they're at. So you'll be seeing some more information about that. So that's kind of a high level overview of the Children's Services Board and the 9 members and what their jobs are. When we put out an RFP and one request for proposal, we have to follow the county process. That means we have to follow the guidelines, and each organization, when they apply for funds, they have to tell us which one of those statutorily eligible service areas that they're going to provide services for. And then they tell us what type of service they're going to deliver. And I'm going to talk about the service delivery types here in a second when I talk about when we talk about communities, not just our department, we're going to talk about the bigger whole county picture too. So our department, as part of the administration of these contracts, have to look at what is our oversight when we make contracts. So when we fund an organization, a nonprofit, we have them sign a contract and they tell us how many services they're going to deliver, whether it's case management, individual therapy. And part of that oversight requires them when they sign this contract, they agree that they're going to do an interim report, a year-end report. They're going to provide performance measures. They're going to track and make sure that what they say they're going to do, they're actually going to follow up and do. They're going to provide us monthly invoices. They're going to recognize us out in the community. You'll see our logo. It looks like 3 individuals, an adult and some kids holding hands out there. We're going to do site visits. We're going to come out and make sure that you're delivering the services the way you say you're going to deliver. We're going to always talk with them about quality, continuous quality improvement. If they're not meeting their goals, how can we help them do some capacity building to help them build, and help them meet their goals? And one of the last things that they're required to do is board presentations. They'll have to provide some type of, it used to be we did face-to-face board presentations, but we've gotten to the point where we have so many organizations and programs that we fund that it's almost virtually impossible to do a face-to-face without it lasting forever and limiting it. So we're actually having each organization videotape and tell us how they're providing services in the community. As staff in our department, we, the Children's Services Fund, I thought I'd show you, part of the information we just recently put together was, and this is kind of blurry, but I thought it'd be interesting to share with you some of the investment information over time. And this kind of shows you, the tax was passed in 2012, but we didn't start collecting it until 2013. So it was, and I don't believe it started right in January. So you'll see that there was the tax revenue and the admin cost. So that's what it costs for us to run the department. And as you can see, what we do is we figured out what is the admin cost to run that department. So it's like 0.01% in 2013. That's just because we didn't have any staff. And as you can see, as the department the revenues have continued to grow, as the department revenues have continued to grow, the admin cost have increased, but overall, since 2013, the average amount of admin cost to run this department is about 4.69%, which is pretty good. We want to be, the most important thing I always say to my staff and out in the community is that this is taxpayer dollars. And I want to be able to say that the taxpayer dollars are being used efficiently, effectively, and we can tell you where all the money is spent and what the money has been spent on. It's really important for me, and that if people have questions or concerns, that they can come talk to me or my staff and say, hey, I don't understand any of this, or I need help, with this. So we want to make sure that we're effective communicators of how these taxpayer dollars are being utilized. So the next thing I wanted to show you was the contracted amounts. And as you will see, in 2013, we didn't have any contracts. So in 2014, you can see the contracted amount with the amount utilized. And what happens here is we may contract with a nonprofit or governmental entity to provide so many services, but they may not utilize this. And this is a way to make sure that we're actually paying for the services that are delivered as per county when you're working a governmental entity. Like I said, I always tell folks, we don't give grants, it's a purchase of service. We're buying something that you're delivering. And so you can see what we thought would be helpful is to look at the average percent utilized. And you can see sometimes it's in 2014, we had a lot of new programs that rolled out. So you didn't see all types of utilization. And you'll see there's, sometimes it dips down. I know in 2015, we rolled out some more new programs, and then you can see utilization is up. And during the pandemic, it went down a little bit, but not as much as people think, because we pivoted and allowed organizations to talk to provide us how can we spend down the money and still provide the services. Because we don't do paper applications anymore. After 2014, we're like, this isn't going to work anymore. We needed some type of online funding management system. So together, working with the City of Columbia Public Health and Human Services Department, as well as the Heart of Missouri United Way, we decided that we were going to use an online application system called Apricot by Social Solutions. And they were recently bought out by Bonterra, but they're still going by the name Apricot. And this is an online funding management system that allows us to be more efficient and effective with our time. Organizations, when they apply for funding through any one of those three big funders, because Heart of Missouri United Way puts out lots of funding, as well as the City of Columbia Public Health and Human Services Department. We wanted to be efficient. And so what we did is we worked together and we put together an organization profile. So when you apply for funds through each one of these organizations, you use the same application, use the same organization profile. And the nice thing about the organization profile is you only have to fill that out once, because each one of those other funders have access to that organization profile. And we were all asking for the same things. We wanted to make sure we were making effective use of their time, if for nonprofits' time. So some of the things that we ask for is like your mailing address, your a copy of your 501c3. Are you in good standing? We want to see a copy of your audit. And if you don't have an audit because you're a smaller nonprofit, we'll ask for a third-party review of your funding records. And one of the most important things is we ask for a copy. They have to fill out a form that reflects who their board members are. And what we want to see is board members that are diverse, that reflect the community that they live in, that they have diverse funding, experience levels and stuff. And what we do is, if we don't see those things, sometimes we work with them and say, have you ever thought about diversifying your board? Have you? So we try to do some capacity building with that type of work. Some of the other things that we do with that is we look at their bylaws. We look at their Form 990s. And their bylaws, what we do is we read that and make sure that if they say they're going to have 12 board members, then then we look at their board members, we should see that they have to have 12 board members. And then we make sure this is a kind of a capacity building tool, but also a way to hold organizations accountable. We want to make sure that we're funding organizations that are financially stable and have the ability to count for all their funds. This allows them to just, like I said, be real good stewards of taxpayer dollars. When they apply for funding, like I said earlier, we all use the same funding management system. So that's very helpful to the organizations. They do the same interim reports, the same year-end reports. We just work very collaboratively with our partners to make sure that organizations are streamlined and have the ability to spend more time with the people in the community. So here is a copy of how the Children's Services Fund money is spent by the population. So you can see we've broken it down into different buckets. And when you look at our year-end report, you'll see it's broken down into the same type of programming. So since 2014, we've spent 1.1 million in basic needs and support. During COVID in 2020, we had the opportunity, when there's some type of natural disaster, there is the ability for the purchasing department to provide emergency procurements. We don't have to necessarily go through the normal purchasing process. And during that time, the board allowed me some levity to actually go ahead and provide approval for funding that the Children's Services Fund could actually pay for. And so you can see that during COVID, the Children's Services Fund paid for $206,000+ for COVID-related emergencies. I believe there was some feeding stuff, young children, I believe the Boys and Girls Club, we paid for some of the work that they did out there in the community. As far as the infant, toddler, and early childhood population, over the years, we've invested $12.3 million in infant children services that have been out there. School-based by far is one of the biggest programs that we fund in the community. There we fund almost 18.5, almost $18.6 million of school-based services. And these are services to school-based age children. It's services provided in the schools. It's services to provide to support teachers out the community, trainings, just a variety of school-based services. Then we have treatment services, and those could be individual therapy, family therapy, group therapy, substance abuse therapy, but it can't be in-house. It has to be outside. So that's something else, because we have to follow those rules that are outlined in the statute. And then any type of youth and family support. We've spent $13.47 million. Most of our programs, I'm going to go back and show you this slide really quick. This slide here. You can see these statutorily eligible service areas. We have most of our programs state that their eligible service area falls within the prevention programs that provide healthy lifestyles among children, youth, and families. This is a very broad definition of prevention programs. And our board takes a very broad view at what prevention programs are. And that means that the board understands that you can't be healthy unless you have food in your belly, you have something over your head, you're able to get to transportation. And how can we work that out? Even though we can't say we're funding transportation, how can we work that out in the unit rate for providing these services? So that's something that we're really grateful for, that our board allows that flexibility. I know that, you heard me mention earlier that there's 9 other counties that have passed the Children's Services Fund, and some of them have a very strict way that they look at these prevention services or respite care services or something, the way they actually define how these services are offered. St. Louis County gets about $80 million every year for services out in the community, which is a large sum of money. I'm happy that we get a little over $8 million, but when you hear $80 million, but they're covering a lot more area. But we're very lucky that our board allows us to fund prevention programs. And I'll give you an example. The board pays for families to learn how to grow their own gardens with, Columbia Center for Urban Agriculture. They help us provide programs within the schools, such as with CCUA. We're also recently, we are paying for some of the program that's out south of town, where the kids actually go out and be a part of the outside wilderness area, where they have the ability to be exposed to fishing, to archery, to hiking, to camping, and some of those things that children would never be able to experience, and they can really grow mentally, and it just put them in a good spot, where they never realized they could have never been exposed to these types of activities. So I'm going to kind of go back to where I was. And then overall, you can see the total amount of money that has been expended is over $54 million. That's a lot of money in the community and a lot of services that are being able to be offered. Total contracts amounts, I'm going back to this slide, have been 67 million. So overall, 78% of the funds have been utilized out in the community. What we have to do as a department is contracted amounts. You can see here I'm pointing that out, like 7 million, 10 million. We are contracting way above what we're bringing in, and that's because we've had a fund balance. And what we're trying to do is get to the point where our fund balance comes down to the point where we can sustain programs at what they're currently funded at. And that's that's fine tuning a lot every year, just trying to weigh, okay, what money's coming in? What are we funding out? What can we put other funding opportunities out there? So those are some things to think about. So, you know, I mentioned earlier that we had purchased an RFP, but the Children's Services Fund also offers what's called strategic innovation opportunities. And that's an opportunity for a nonprofit or governmental entity to request funds to go to maybe a one-time funding opportunity at match funding, funding to bring in a speaker, funding for a program that they didn't see a need in it when the original RFP came out, but all of a sudden they do see a need for it. So every year the board puts approximately $500,000 into a strategic innovation opportunity fund for programs to apply for funding. We also allow organizations to, if they want to apply for funds and they utilize all their services up, there's a way to ask for supplemental funding as well. These are just some of the organizations that we fund. Currently, we fund 40 different organizations with 56 different programs. And these are just, I try to get most of the logos of the organizations that we fund. But if you go into our website, you'll be able to see what we've done is included. We have a tab that talks about all the funded organizations. You can go through and you can actually look at what those funded organizations actually provide in the community. And you can see there's a lot of different types of organizations. Like I said, everything from Columbia Center to Agriculture, to childcare programs, to home visiting programs, to mentoring programs, to respite care programs, home visiting, these domestic violence. So there's all different types of programs that are actually out there. And one of the last things I'm going to show you is, oh, you've got a question? Sue, or? Oh, you're on mute.
I'll wait till you finish your presentation.
Okay, okay. Lastly, I just wanted to talk about our collaborative group, the Boone, what we call a Boone Impact Group, and we call it BIG for short, but it's just a collaborative group that started in about 2014, really got going in 2015. And like I mentioned earlier, that has to do with the Heart of Missouri United Way and the Columbia Boone County Department of Public Health and Human Services Department. We have all agreed that we need to take a collective impact approach to any of the work that we do. And that underlies all the community-based work that we fund. So in order to make sure that that happens, what we've done is we started with the shared funding management system. I talked about Apricot earlier. The next thing we did was we put together a taxonomy of services. We knew it was important that we all spoke the same thing and we all defined everything the same way. So we put together a taxonomy of services. So we all agreed that what does case management look like? How is it defined? We came to the agreement with that. We work with the organizations to say, does this make sense to you? Are you okay with this? We say this is kind of one of those documents that we know there might be services that we missed, or we may have to change the definition because people don't understand it. Then we created our Boone Indicators Dashboard. And this is a dashboard that we work with the Missouri Institute of Public Policy to provide all types of data. And it talks about, in it, it provides a warehouse of information of data that is Boone County Central. And when possible, we kind of break that down into what does the state look like? What does our county look like and how are we doing? And if we can break it down further, like school districts, what does our school district look compared to statewide school districts? And it also, in some cases, it provides an equity analysis of what we need to work on. And it also provides a trend analysis. How are we doing over time? Are we in the red? Do we need to work on something? Are we doing well? So that dashboard is also available. The next thing that we looked at was common outcomes. We knew that as a community level, we wanted to work on the same outcomes. And what is that? How do we define those? So here again, the Boone Impact Group meets twice a month, and we talk about issues that come up with organizations and how to make sure that we're efficient, effective with the resources that we have, as well as we're all speaking the same language. And that's how the community outcomes came together. So we all agreed that when an organization applies for funds, their performance measures, they're going to tell us what common outcome they're going to work on. And then what they do is they tell us, they provide indicators of how they're going to do it. They tell us how they're going to measure it. And then the timeline for and what resources they're going to do and how they're going to measure that work. That's how we talk about continuous quality improvement. How can we help organizations do a good job of collecting the data that they need to do and showing that their program is making a difference? And what we want to do is we want to ask ourselves always the question, is anyone better off? Are the families better off? Are the kids better off? Are the adults in the community better off? So this Boone Impact Group has really made a difference. They made a difference during the pandemic, and they continue to make a difference in our community. There's not hardly any other communities that can do this. We've recently, when the pandemic started, we invited foundations to join us. So we now have once a month, we meet, the big group meets with the Veterans United Foundation. We meet with the Community Foundation. We meet with people who are the city folks who are working on ARPA. We work with the folks at the city home who handle the CDBG and the home funds that are invested in the community. So we all are trying to work together to really make this community a better place to be and make the most efficient use of taxpayer dollars. So I've talked a lot. I welcome questions now, and there's a lot of information that I just gave you. It's just a snippet of the information that that we have in our department. So I welcome questions. And Sue, do you have a question?
Yes, I do.
Mhm.
I wanted to say thank you. I am very glad to hear that you're doing so much collaboration within the county on private and public funds. In addition, I want to say that the other thing that I'm so glad that this passed to get these funds in this particular organization, and I remember there was when the push was on to get that. That's very important. But I also worked in Jeff City for many, many years and carpooled with different people. And one thing we need to keep in mind, and partly because of our community providing services over the years, public and private, and because of having such a big medical center, we have a larger portion of people that need these services than many parts of the state. And so our challenge is greater. But I had a kind of specific thing that I wanted to ask about, and I can't remember the exact name of the organization, but the Everybody Eats and the Almeida Creighton kind of things went to this progressive something or whatever it is in Parkade.
Mhm.
Is that part? I didn't happen to see their name. Is that one of the groups too also?
No, they have never applied for funds.
Oh, interesting.
What we have done to address some of those nonprofits that are almost what we consider grassroots.
Mhm.
What we're trying to do is try to figure out ways to build them up. And one of the things that we did last year was we recognized that we're not having those small nonprofits who are actually boots on the ground, really working with those folks, getting funded. And so we're taking an introspective look at how we can do a better job at that. The last time we put out an RFP, which was last year to begin this year, is we tried to hold some training sessions on how to apply for funds. And we also put some videotapes together that is on our website. We put all types of funding handouts that would be helpful for organizations who want to apply. So we're trying to look at that. And we're also in the process of possibly looking at some other potential things that we can do to help those grassroots rise up and to be able to apply for funds. So we're hoping next year we'll be able to actually have that ability for grassroots to actually apply for funds.
There was another question. I noticed on your funding, it changed. 2016 was very different than the other years.
Okay.
And maybe that was still when you were trying to figure out who you were going to fund and what you were going to fund.
Yeah, I think it was 2015 where we contracted amounts was 4 million. And then the next year, the contracted amounts were that 1 million. And that was for newly contracted, and then it jumps up. That's a,
No, it was the categories they were in. So
the
there
categories. Okay.
that's what I was noticing.
Yeah.
2016 seemed to be kind of unusual.
Yes. Yeah. That's a great question. I'm looking at it right now.
Joanne, is that when we had some 18-month contracts? And so
That's
normally
right.
those figures are really clear when it follows an exact calendar year. But I think we had some 18-month contracts, so they may have appeared in 2017 or like a different calendar year, if that makes sense.
Thank you, Kristen, for remembering that. Yes, and we had those 18-month contracts and it became a nightmare to try and keep track of. So we went to strictly 12-month contracts with the possibility of a renewal. So thank you, Kristen, for remembering that. And thank you for pointing it out, Sue.
Yep.
Okay. I don't know who is next with questions.
Yeah, do we want to do Mari and then Pam and then Alice?
Sure. Mari?
Hi, I just wanted to reinforce the importance of the collaboration that goes on with the big group. And to say that as a long-term United Way volunteer involved in the Community Impact Council, it's been wonderful to see the evolution of that partnership over the last several years to where, and I can't help but think that the agencies must really appreciate having one format for their applications and one set of reporting to do, because not that long ago, they had to do multiple different reporting forms and application forms and so on. But my question has to do with the issue of transportation, which of course the United Way knocks up against a lot in its funding, even though we're not necessarily prohibited from spending on transportation. It is nonetheless very expensive and difficult to show impact for that money that's spent. So my question is, are the private foundations able to help with that when the county and city cannot? Such a barrier to
It's a
receive
huge barrier. And I'll tell you how we've addressed it internally. When we have organizations apply for funding, they give us a unit rate. And when they give us a unit rate, what we tell them to do, and it's in the directions, is you have to tell us what expenses go into that unit rate. So for example, if you're going to do home visiting, what does it cost for staff time? What is your indirect rate? What is the services? But then what we also ask for is you can include the transportation cost in there because that's the cost of delivering services. So if it costs you $40 to provide an hour of home visiting, that transportation cost is in that unit rate. And that's what gets confusing to folks is how do you figure out that unit rate and make sure you account for all the charges that could be in there. So they're not directly charging off for transportation. They're charging off for the cost of delivering that piece of service, which could have the transportation embedded in that unit rate. I hope that makes sense. It is very complicated and stuff.
Sure, and I'm glad to hear they're able to do that.
Yes.
I'm very appreciative of the flexibility that your organization has shown as it's grown.
Thank you. Okay, was Pam next?
Yes, yes. You did state that lack of transportation was a barrier. Are there other ones? And I especially want to know if you have enough psychologists, because I just hear generally people sometimes have to wait a long time to get an appointment.
When we've done our, I told you in 2014 and 2019, we did reviews, and the lack of child psychiatrists is probably the #1 access issue that we have. And right now, actually, the lack of licensed clinical social workers to provide individual therapy is another huge access issue. And we've seen that, I think during the pandemic, afterwards, we saw a lot of people leave that type of work just because of their mental health. But the good thing is we're seeing more kids and youth and families saying, it's becoming okay to say, I need some mental health help. And so we do have that access issue with that. Unfortunately, is not having enough. And we're lucky because we have a very great child psychiatrist here at the university, and we're able to help maximize our funding by having fellows that can provide child psychiatry within the schools. And those fellows have to be overseen by a child psychiatrist. And so we're able to maximize our funding by having some of the fellows see some kids because they're overseen by a child psychiatrist. And so we are very lucky in that respect, is that we have that wonderful resource here in the community.
I also want to say in the report, I remember on many pages, there are stories of people being helped by what you have done. And it really does make you feel good because there's some really positive things happening there.
Yes, thank you, Pam. I appreciate that. Alice?
Joanne, I just really want to thank you. I too remember when this tax was passed, and I was going to comment, but Mari already covered it about that collaboration that you've created. I just wish, having worked almost 30 years in public health, that I had known more about you while I was still doing that, and I would have reached out to you to educate your clients through your agencies about West Nile virus and Zika virus and all those different things I worked on had I known more about your work.
Yeah.
But really exciting. Thank you for sharing this with us. But I also think you must be one of the larger departments in Boone County government with that budget. Am I wrong?
Well, we've been fortunate that we went from a small department with just 2 of us in 2014 to now there's actually 7 of us in the department. We've added a program diversity, equity, and inclusion specialist. We've added a program manager now that one whole project that I could spend another whole couple hours on is our upward mobility project that we started with a grant that we had received through the Urban Institute. So we have somebody who's coordinating that. And we also have a program diversity, equity, a program data analyst who can help us with performance measures and doing data analysis on what we need to do better. So it doesn't seem like we're the largest, but we do hold our own over here in our
Yeah.
little space.
Thank you. Great work. And I also like your broad definition of prevention since I spent my life working in prevention.
Mhm.
And I hope, so we now have this new marijuana law that has various avenues for education on drugs. So I don't know how you tap into that, but that's one of the big things that they're going to use with their funding. But you really don't need funding. You just need to allocate it. So I guess.
Yeah. You know, people always say you don't have enough funding. It is true. I wish I had enough funding to give everybody their own, pot of money, but we really are, we want to hold people accountable because it is taxpayer dollars. And we want to make sure, like, we've always say, is anybody better off? If, that's ultimately we want people to be is better off. So.
And having looked up the poverty rate.
Anybody
which is
else?
about-
We're all caught up with the questions
go
in the
ahead.
chat. Going once, going twice.
Are we finished? I don't know if Sarah froze.
Alice, you want to go ahead and ask your question? Or make your other comment?
You're muted, Alice.
No, I don't really think I'm just really excited to hear about all these programs and getting into that aspect.
You were
It's
saying
an
something
area I
about
haven't worked in.
poverty. You were saying something
Oh,
about the poverty level.
I thought the poverty rate in Columbia is about close to 20%. So I would imagine a lot of your clients fall within those Medicaid numbers. And here, what are the ways, Joanne? I guess you encourage your people to register to vote. And if they're living in a temporary shelter, they can still vote, right? Or
Well, we really don't talk about voting, but what we do push is we encourage our funded organizations to get people to, ever since Medicaid has expanded, is to sign up to get Medicaid expansion. And what we do as the funders, part of our funding policy is be the funders of last resort, which means all other funding sources must be utilized, which means insurance or Medicaid, before you can charge us for any type of funding. That way we maximize our dollars as well. The nice thing is the money you saw that wasn't spent goes back into the Children's Services Fund. It doesn't go back in to a general fund. That money stays within. So that's what we tell folks all the time, is that's the way it's earmarked. So it doesn't go away. We just reallocate it for other programs out there.
okay.
All right.
All right. I don't know how much you heard before. So sorry. The internet gets a little thin back here in my bedroom where I'm sequestered with my COVID self, which is why I'm not normally in here. And I'd forgotten that it might drop out, so I should have warned you. Any final questions? This has just been a really great discussion. I was saying before, I learned a lot. I don't know how much of it you heard before I froze up. Well, with that, I think we should thank our speakers. Thank you very much for being here. And we can move on to the business portion of our meeting, which is some announcements.
All right.
And you two are welcome to stay, but certainly don't need to stay unless you just are interested in what we